Hi, I'm Dr. David Goldblum. I'm a psychiatrist, and I'm here at CAMH, also known as the Centre for Addiction and Mental Health, which is Canada's largest mental health and substance use teaching hospital. In this series, we're exploring the top mental health questions on the internet, so make sure to subscribe to our channel and turn on the notification bell to stay informed. Having binge eating disorder involves experiencing a loss of control over how much food you eat and having episodes of overeating that can last a few hours. During each binge eating episode, a person will consume more food than what most people would eat in the same amount of time. People with binge eating disorder usually feel shame or disgust during and after each episode. They may judge themselves harshly or feel that others think negatively of them. This shame often leads them to hide their binging, for example by eating alone, to avoid judgment, or to struggle with feelings of depression or self-loathing. Signs of binge eating disorder include eating unusually large amounts of food in a single episode, feelings that one can't control the binge eating, and feelings of disgust or shame about overeating. Binge eating disorder is different from other eating disorders like bulimia nervosa and anorexia nervosa because it usually doesn't include limiting food intake or fasting, significant weight loss, self-induced vomiting, abusing laxatives, or excessive exercising. Doctors have noticed that their patients are often interested in the relationship between obesity and binge eating disorder. But both obese and non-obese people can have binge eating disorder. Nevertheless, research shows that it is most common in those who are obese, and those who seek help usually do so first for treatment of obesity rather than for binge eating. Mental health professionals have found that it can be more difficult to treat obesity in people who also have binge eating disorder. Challenges related to binge eating make it difficult to control eating patterns in obesity treatment. For this reason, when people seek treatment for obesity, it is important for their doctor to assess them for binge eating disorder so their treatment can focus on resolving these eating patterns. Research shows many different factors can make someone more likely to develop binge eating disorder. These factors include experiencing abuse or neglect as a child or food insecurity. Being bullied or teased about one's weight can also increase risk. Biological components to binge eating disorder also exist. Symptoms of binge eating disorder can be difficult to detect, and some affected people don't seek help. However, treatment is available. To treat people with binge eating disorder successfully, a doctor first has to find out if they have other health concerns, such as obesity and diabetes. Clinicians also need to check whether they have other mental health problems, because research shows people with binge eating disorder often have other conditions, such as anxiety and depression. There are different treatment approaches for binge eating disorder. Research evidence demonstrates that psychotherapy, or talk therapy, can be used to treat binge eating disorder successfully with potential for long-term benefits. Approaches like cognitive behavioral therapy and structured self-help psychotherapies focus on helping people manage the negative emotions that trigger binge eating and develop a sense of control over their binging. Research also shows that medications like lisdexamfetamine can help some people stop or reduce binge eating episodes. Binge eating disorder is complex. To prevent binge eating disorder, it's important to address contributing factors that make people more likely to develop binge eating disorder, like food insecurity, as well as reducing childhood bullying and weight-related teasing. Reducing body shaming and combating the stigmatization of obesity are important too. More broadly, for many good reasons, we want to reduce childhood trauma, abuse, and neglect. Binge eating disorder can be difficult to understand, but with the right information, we can identify when our loved ones might need help. I'm Dr. David Goldblum. Did you like this video? Subscribe to our channel for more evidence-based insights on mental health and substance use.